I think as a doctor, you're like basically not that you're a therapist, but you need to know these things because if you're not uncovering them, then you're just kind of guessing and you're treating something when you don't know the root cause of it. So I definitely try to take the time to get to know somebody. I ask a very long list of medical questions that takes them 20, 30 minutes to fill out.
Yeah.
And because I want to know everything about you.
Yeah.
And then I want to know kind of like, where do you think you're at? Like, do you think you're like some athlete, rock star, super health right now? Or do you think you're like really unhealthy? Because usually it's the people that think they're, oh yeah, I'm super healthy. And I'm like, dude, you are a absolute train wreck, right? And we we gotta fix this. So I really try to meet people where they're at. I do not try to discriminate. Everybody deserves to get 1% better every single day or 1% better every month, however you want to do it. But incrementally, everybody should be getting better.
Welcome to MyMD Unscripted, where healthcare gets personal and the script gets tossed. I'm Dr. Clint Carter, ER doctor turned direct primary care freedom fighter, on a mission to challenge how our healthcare system treats patients in America. In every episode, my expert guests and I dive into real conversations about what's broken and how we can fix it by making healthcare about people, not just managing disease. It's time to rethink what healthcare should be and how we can make it better together. Welcome to the podcast. Hey, y'all, and welcome back to the MyMD Unscripted podcast. I'm your host, Dr. Clint Carter, and today I am honored, and I mean that because his practice is much too much like mine. It's just going to be fun to have a conversation. We're joined by Dr. Russell Van Maele. He is the founder of Black Sheep Health, where he helps patients break away from the one-size-fits-all medicine junk and pursue true optimization, hormones, peptides, movement, nutrition, and purpose-driven living. He wraps his faith into his practice. I think it's beautiful. His approach blends performance medicine with a deeper focus on longevity and resilience and what it actually means to live well. And we're going to get all into it today. So Dr. Russ, thanks for joining us, man. And I'm going to let you introduce yourself properly, but I guess I'll open with the question that almost drives my practice. I mean, why most people come to me, the question is, why do so many people feel like they're doing all the right things? Their labs look relatively normal and they still feel off. So with that, I'm going to let you introduce yourself, man, and tell us how we got here.
Yeah. My name's Russ Van Meele. Went to medical school at Michigan State. Grew up in Michigan. That's my career backstory. But my things that I'm really proud of, been married 3 years to my wife. I have two young children, a boy who's 2 years old and loves to play with trucks and get on my tractor every single day, which he is much too young for. And then my daughter, who's about to turn 1 in May. And
Yeah,
then
you're in the throes, man.
we are in the trenches right now, but thankfully I have a loving wife that is willing to stay at home because her job is a lot harder than mine. So
Yeah, for sure.
it was funny. Actually, one day she came. I have this office is like a 12 by 20 office, and she came in here one day, and it was like perfectly silent, and that's how it is most of the time when I'm not talking to people. And she's like, "Is this how it is every single day?" And yeah, it's gotta be quiet. Otherwise, I can't do my job. So she doesn't get too much quiet, but
No,
love
she
my
doesn't.
wife, love my kids, and then at the core of everything is that I'm a follower of Jesus, and I want to just walk with God every single day. I stumble a lot, but I'm always trying to get back up, and that is my purpose in life is to follow Him because that's where I believe I'm going one day, God willing. So
Yeah, man.
trying to have every aspect of my life revolve around that.
Well, and we won't turn this into a sermon, but ultimately, forever starts now. Like the kingdom of God overlaps here. We're participating in God's plan going forward and trying to bring a little touch of heaven to those around us. So I love that God has put you in this place. How
Mhm.
did you end up creating Black Sheep Health, and what does all that mean?
Yeah. So, I think it's like I was actually go back a second. I was reading Matthew this morning in the Bible, and I always go back to the parable of the talents, of
Yeah.
the 10 talents, the 5 talents, the 1 talent, or no, five, 2, and 1. But, you know, God gives everybody something. You know, I might not have $1 billion in the bank account. I might not have $100 in the bank account, but I can, multiply that with whatever I have been given. And I certainly don't want to bury it in the sand. I'm truly blessed. I have to constantly like tell myself how blessed I am, because this life and this career, being an entrepreneur, is very hard. But
Yeah.
to be able to be in this situation and still support my family is the ultimate blessing that I just want to give back to God, and multiply his kingdom with those talents that I've been given. Um, but the story of Black Sheep, you know, I've been in the telehealth space for a long time. I've kind of know the ins and outs of the whole game, because I started in it basically right out of residency, because that's based when COVID happened. I was in my
Oh,
senior year of or chief year of internal medicine, and it all started there. I was like, I'm a DO, so I do OMT there, and I'm cracking backs and necks and using my hands and everything in person. Then go
yeah.
figure, I become a telehealth doctor. But I was always a little bit different, as you could say, as far as like how I handled medicine. I didn't like to put anybody on medicine if I didn't have to. Want to always incorporate lifestyle first. I wanted to incorporate, my spirituality, my faith, and kind of not push it on people, but encourage people to find their purpose. And I found out that a lot of times that worked for people, to get them to get healthier.
Yeah.
So I felt like I've always been kind of everybody got rolled their eyes at what I was doing. But then I always had a waiting list of people that wanted to see me too. So that being said, like a couple years go by, and my brother calls me the black sheep of the family. I moved to Arkansas just recently, actually. The rest of my family lives in Michigan. I still love every person in my family, and I still love Michigan, but I do things a little differently. I'm not afraid to do it and take chances on things.
Yeah. Yeah.
So at first, when he called me that, I was like, "Dude, are you serious?" So that's like it's a low blow, right? It doesn't always have a positive connotation to it. And
No.
thinking about it, I'm like, that's a perfect name for a health company, because of what I want to coach people and treat people with, like, not like everybody else. I do
Yep.
not want everybody to follow in line with all the sheep, basically, that
Yep.
are living in this world, and nobody's thinking, nobody's acting on it, and everybody's just getting worse and worse, so more and more unhealthy. And I think there's a much better, simpler way to do that. So I kind of channeled that in. And obviously, a sheep has a lot of biblical ties to it as well, because
Yeah.
Jesus, like, having the sheep, and you know he we are following him, and we should be led by him. So I like the name. It took a long time to come up with the logo and whatnot, but it's like, it's fun to do this whole entrepreneur thing. But I'm really enjoying it.
Man, and I loved as soon as I saw the name, I was like, I like this guy already. Because they are. I mean, people. What is everyone's complaint when they go to the doctor? Well, they're moving us through like cattle.
Yeah.
They don't spend any time with us. We sit over here, then we go through this chute to this room where we sit. Doctor comes in, stares at his screen, and then he moved me down another chute. And I was like, and then the black sheep, there's like, we're going to do it
Oh,
differently because lifestyle modification is indeed a punchline in residency. They're like, well,
oh
yeah,
yeah.
no one's going to do it. So that's stupid. Let's just
Yeah. Yeah, exactly.
the candy bowl of statins and start passing them out. And so,
I know. It's tough. It's frustrating.
and in residency, which a little window into like what residency's like for the non-doctor listeners out there is at in residency clinic, you take over another resident's patients who took them over from another one, and maybe they were with you for 1 year or 2 years too. But these patients have seen like 10 docs in the last 8 years, and everyone just added medicine, and no one ever took
Mm,
any medicine off. Like these med
yeah.
lists are insane, and
Yeah.
largely a lot of the patients are sick.
Yeah.
But
Very sick. Very sick.
the very much a ministry to be in a residency clinic, if you've got the right
It's
mindset. However, like, as soon as I got to my 3rd year, or maybe even 2nd, but definitely 3rd, I was like, "Okay, time to start taking you off some medicines. Like, let's figure out what we can stop." And the patients were confused, like,
yes.
"No, I need all of these." I'm like, "I don't
Yeah.
think you do."
Yeah, yeah, that's all they've known. I haven't that thought hasn't crossed my mind in, like, 6 or 7 years, but you're so right. Those poor people just keep getting a new doctor every year, or every
Yeah,
3 years, really, but
3 max, sometimes 1.
yeah, the max, yeah, sometimes it's less than that, but yeah, that was tough. That was residency clinics are by far I would say one of the hardest spots to practice medicine because
It's hard.
it's
And they
culture.
come to you loaded with diagnoses and
Mhm.
medications, and
Yes.
it just gets the list both lists just get longer and longer and longer.
Yeah,
And
but that's
yet,
what I'm
you're
oh, go
trying to
ahead.
avoid that. That's why we
I
exist.
know.
They
Yeah.
let's not do that, you know?
Yes. Something that satisfies me the most out of any patient that I see is having them come off of a medication that they didn't need.
No.
Every patient that I come in, I call it my medication reconciliation. It's got a nice ring to it. Every single one of my patients knows what med they take, how much of it they need to be taking, and what is it doing for you. And then
Yeah,
finally, can you supplement this with something else that's not a medication, like
yeah,
something like exercise or eating healthy?
yeah,
And that's how I try to get people motivated. Be like, hey, this one, you'll be on this one forever. Okay, you had a heart attack. This one, I don't think you need to be on this one forever. And people are like, oh, wow, I don't need to be on my antidepressant. Are you
yeah.
sure?
We'll find out. Let's go.
We'll find out. Like we will never know unless you try. And there's certainly times that you try and it doesn't work and you put somebody back on, but at least you tried, you know?
And, you go from, antidepressants are great because there's a place for them for sure.
Absolutely.
How however, for me, when I got on my antidepressant, I was, burnout from the ER, trying to start a practice, got another job, doing, and it was just low T, eating crap,
Mhm.
overweight, just all just, yeah, of course, my brain was like just survival mode depression. And
Yeah.
then eventually you start replacing the hormones and you get the exercise and you start eating a little more healthy and you really focus, it's like time to focus on something other than work. And now, with the grace of God, I'm not on an antidepressant right now. Now I've been
Yeah.
on them, off them in the past.
Yeah.
Okay.
Sure.
Been a
Sure.
vacation or two that we paid
Yeah.
for that sucked because I was off my antidepressant. But,
Sure.
over
Sure.
the years, learned my lesson. So
Yeah.
yeah,
Yeah. Yeah.
that's why this and let's start talking personalized. You have a very personalized approach, small panel of patients, a
Yeah.
personalized approach to medicine because
Mhm.
this this thing that we're doing in life is a journey. And it'd be great if your doctor knew you well enough to go on this journey with you.
Yeah.
Instead of just like, well, I guess I'll go to the urgent care or the ER or this random telehealth guy or whatever. Tell me about your sort of how you approach taking on these patients, one at a time.
Yeah. Yeah. So I am all about the relationship with people. I get fueled by human interaction. I am very much a extrovert, and I love getting to know people and tie in like faith in this when you kind of not that you're pulling the faith card, but you're like, hey, I'm a Christian and I think I'm going to the same place as you. Like I'm trying to get to the same place as you in life. I'm trying to walk the same walk that you're trying to do. It's like the doors and the walls come down. And that's when you really get to know somebody. That's when you find out about the family trauma or the childhood trauma that came out early in life. And that's now why you're depressed. You find out that dad was an alcoholic and that's why I have a problem with alcoholism. Dad hit me, or, mom wasn't around, or like some of these like traumatic things that you can pull out of people. So I spend a lot of time just chit chatting, and I
Oh yeah.
always schedule, and that's why, I'm blessed to have a small panel, because I spend a lot of time with people, and you know, previously, like other jobs and other jobs that I supplement with right now, it's like if I had a dime for every time I said, "I'm sorry, I'm late," because I am that guy. I am like at least 5 minutes late for every single person, because 30-minute appointments, like, I'm just so bad at it. I know I need to like do better. I've been told in all my reviews, like, hey, you need to do better on timing. I'm like, but I was like enjoying the conversation. So,
Yeah.
um, I think as a doctor, you're like basically not that you're a therapist, but you need to know these things, because if you're not uncovering them, then you're just kind of guessing and you're treating something when you don't know the root cause of it. So I definitely try to take the time to get to know somebody. I ask a very long list of medical questions that takes them 20, 30 minutes to fill out.
Yeah.
And because I want to know everything about you.
Yeah.
And then I want to know kind of like, where do you think you're at? Like, do you think you're like some athlete, rock star, super health right now? Or do you think you're like really unhealthy? Because usually it's the people that think they're, oh yeah, I'm super healthy. And I'm like, dude, you are a absolute train wreck, right? And we we gotta fix this. So I really try to meet people where they're at. I do not try to discriminate. Everybody deserves to get 1% better every single day, or 1% better every month, however you want to do it. But incrementally, everybody should be getting better. And then for the aging population, which is longevity medicine, which is literally every single person on the planet is aging,
Thank you.
preserve it, preserve the process. Do not have this downfall of hormones, or just like, throw in the towel. It doesn't matter anymore. I'm not going to eat well. I'm going to eat this junk. I don't need to exercise anymore. I'm too tired. It's like, honestly, I don't have a good, not that I don't have a good relationship with those patients, but we just don't drive. I want people that are motivated to want to take care of themselves and have a goal in mind. And we're constantly setting new goals, because what is the finish line in health?
Yeah.
There is, I don't know that there is a finish line. You call death the finish
Yeah.
line, and everybody's trying to, you know, die, healthy, but in reality, it's going to be a decline. It's just, how fast do you want the slope to be?
Right. Right.
Right.
I mean, we've had several generations now where the lifespan and the health span were very different, right?
Yeah.
It's almost a decade of senescence, of just painfully, slowly dying, asking God to take you home for like 10 years before you finally
Yes.
mercifully pass away and get it to move on to the next life.
Yes.
And it's like, that's not how it used to be. And medicine got
Mm-mm.
really good at lifespan,
Yes.
but it's hard to measure health span sometimes. It wasn't on the radar. And now it is. And there's this whole longevity movement. And quite frankly, every patient is a longevity patient,
Yeah.
right? And you are going to be, your practice is and will be self-selecting for the folks. Like, I also want people all in and trying to be healthy because, number one, you're going to feel better. You're going to be happier. You're going to have better mental health. You're going to have better physical health. We can talk spiritual health. You can't just sit there and take enough medicines to keep your cholesterol down and expect that to make you fulfilled.
Yeah.
God there's a reason, what is the two most important days of your life is the day you were, well, this is the secular version, the day you were born and the day you found out why, right?
Mhm.
There's then why, and it will have all these obvious, especially all these years in the ER, someone have a big old terrible accident or a big heart attack
Yeah.
or whatever.
Yeah.
You're like, I don't know why you're still alive, bro, but God's not finished with you yet. You know,
Yeah.
those, that's that patient that gets us all fired up. That want
I
you
know.
want, all right, let's go. Let's help you. Patients come
Yes.
to me all the time and be like, I guess I'm doing, I mean, I don't know why I'm here. I guess I'm doing well. I'm like, no, it's great. You're not on fire. That's awesome. Let's
Yeah, yeah.
let's
There's
talk
nothing
about
wrong with that.
the next decade. Let's talk about the next
Yes.
decades. Let's go.
Yes.
Um,
Yes.
Tell me about your
And
approach to longevity.
yeah, so my approach to longevity, goes back to the root, find out if they're, meet people where they're at. Are they on medications? Do they have a medical history that's been managed by residents or whoever in the past? You know, basically put out any fires at first, right? Build the
Yeah.
foundation. And in my practice, and I know it overlaps with you too, but my foundational principles are always going to be exercise, nutrition, how you manage stress, how you sleep, and your faith and purpose. I'm trying to add community in there, but I think that's part of the faith and
I
purpose.
think it
Like,
is.
you
Yeah.
know, because you gotta have people around you to support yourself. And all of these blue zones, they all have wonderful communities that they are
Yeah.
very much socialites. They're hanging around people, they're laughing. I can easily right now, if I wanted to, I'm in my empty office with just me talking to a computer all day long. I could do this like all day every day, and I need to see people, I need to chat with people, so my wife hears all my stories and whatnot, and my kids and whatnot. But those core principles are where I
Yeah.
start everybody, and I very much follow a natural approach. I am not natural in the sense that I don't use hormones, I don't use peptides, I don't use supplements, because I absolutely use all of those things. But like with a house, if you build on a terrible foundation, it's going to crumble. I think that's what most people are doing right now, especially with like
Yeah.
GLP-1s. They're trying to build a house. It looks nice on the outside, but it's got a terrible foundation. So I really think in medicine, we always underestimate the core concepts of just basic health. That kind of gets pushed to the side, and we're always like, all right, what's the biohack that I can do? How many minutes do I need to be in that cold plunge? I'm like, dude, forget about the cold plunge right now. When's the last time you've exercised?
Yeah.
So
I love it. I love the peptide consults. Like, I want to talk peptides. I'm like, dude,
yeah, yeah.
you don't need, you've got way bigger problems than peptides,
Yeah, much bigger problems. You think a BPC's a 157 is going to fix your
Yeah.
arm that's falling off right now? I don't think so. Okay.
Uh,
So yeah,
yeah.
everything goes back to natural. And then, I try to be the first example of that. I try to practice what I preach. I try to exercise most days in the week. Last 6 months, I got into jujitsu. So I got like a guy yesterday kind of smashed my
Nice.
face in. You should see what he looks like, though. No, I'm just
Oh,
kidding.
of course. Oh, yeah.
But you should see the other guy. But I love to do hobbies that are active. I love to mountain bike. I love to, this jujitsu has been a hobby of mine. Well, biking with my family. We raise our own chickens. We'll probably have horses one day. If I had it my way, I'd be living off the land. And then I've got
Yeah.
like, I got a buck hanging from my wall on the other side. I'm kind of a little hesitant to put it like right here, even though I really want
Yeah.
to. So,
Yeah.
but hunting and fishing, living off the land, exercising, bare feet most of the time. I try to be as natural as possible, but then meet people where they're at. If you're in New
Yeah.
York City, you can't live my lifestyle, right? So we got to work around that.
Yeah.
But that's where this type of medicine is really cool, because we're all about what's your longevity protocol? What's your peptide protocol? What's your hormone protocol? I'm like, I don't know how to put it into a protocol. Everybody's going to be a little bit different. And
Yeah.
this person might not need that peptide or that hormone, and your hormones might be fine on your own. I think it really does come down to personalized care, knowing the person and establishing that relationship where they trust you, not only as a person but your knowledge too, and you know carrying out the journey like you said.
Yeah, and I was going to ask what tools you use, but you covered a lot of them. I mean, obviously, the foundation of exercise and diet, and they don't teach us anything really about exercise or nutrition in medical school. I'd like to get that out there for the listener.
Yeah.
If you make an appointment to go talk to your doctor about nutrition, he's going to have to Google it. Like, unless they've
Yes.
done extra education and really dug into what's really going on, cardiologists have been telling people to do low fat diets for 50 years. I mean, how's business?
Yeah. Not good.
It's, just luckily it's the information age. The information's out there. Sometimes it's hard. Problem is you can get someone to tell you whatever you want to hear, whatever you're listening for.
Sure. Sure.
But, the plastics, the toxins, the processed crap, it's lovely that it's becoming more mainstream.
It is.
The
It definitely is.
functional food and exercise a bit, the grounding and even some of the spirituality of it is becoming a little more
Yeah.
mainstream because, you're largely a post-Christian society in technically in most of the country, maybe not
Mhm.
East Texas and maybe not all of Arkansas, but largely like the spirituality is kind of cool again because your grandma's not preaching to you every Sunday or something. I don't know, but
Yeah.
what's
Yeah.
great, it's kind of becoming mainstream because we don't know. And then of course the peptides and hormones and the GLPs, which is technically a peptide, and
Yeah.
uh, all the functional medicine tools of supplements and that kind of stuff. And we're not even technically functional medicine trained over here at my office. My partners in some other related offices are. Are you functionally medicine trained?
You know what? So I wouldn't say I'm a carnivore, but I eat meat and eggs
Yeah.
every single day.
Yeah.
Eat meat and veggies is kind of my go-to 90% of the time.
Yep.
My first conference was the Institute of Functional Medicine. And I did that in residency. And I
Yeah.
was like hardcore keto at that point. Like that's when
Yeah.
like keto is really
Yeah. I was
probably
having
at its
with
yeah. Yeah, yeah. So I'm like hardcore keto. I haven't had over 50 grams of carbs in 6 months at this point. And I was super lean. I show up at this conference, I'm like, yeah, functional medicine, this is for me. And I found out that it was a vegan conference after like the first or second lecture. And I'm like, it was all vegan speakers,
no way.
and like the Esselstyns of the world and whatnot. And I'm like, I'm like they're like, "Oh, meat's gonna kill you, and eggs are gonna kill you, and saturated fat's gonna kill you," and everybody's like, "Yeah." And I'm looking around, and whoa!
Yeah, like
I just
can
had
you
8
breathe?
eggs for breakfast.
Yeah.
But so that was like the only like functional medicine conference that I've
You went to the
ever
wrong conference.
I went to the wrong one. Honestly, I've never been to an A4M. I have to do a lot of reading. I gotta stay
Yeah.
up to speed with that. And honestly, with the access to information these days, you can go down the rabbit hole and
Yeah.
make your own
Right.
functional medicine. I actually don't even like the term functional medicine because I feel like everybody and their mother is a functional medicine
I do.
doctor, like overnight, like
I do.
influencers. I'm a functional medicine expert. I'm like, hey, my bachelor's is in physiology. I've always been a nerd when it comes to science, and that will never change. Like,
Yeah.
physiology doesn't change. So, if you can restore your natural God given physiology, that's what functional medicine, it
That's
should
what
be,
it's
that's what
right.
it's all about. Right. So, I don't like to say I'm functional medicine trained, but like, I do definitely go to conferences
Yeah.
and whatnot.
I
I'm
went
a
to the
part of the,
last A4M. You wanna know what their pillars are? On every lecture, every topic, it all comes down to diet, exercise, sleep, and stress. And gut
every
health
time.
is a part of that. And
Sure.
so, like, I mean,
It's,
yeah, those are
it's,
your pillars. Like,
I know.
it's not rocket science. What I do like about the A4Ms or, IFM functional medicine training places is they are expanding the reach of people that can get that, I guess, certification, get that knowledge base and help people out. Right.
Sure.
So, um, I'm happy that more people are going to be exposed to that, except that it's not really apples to apple. I mean, I like it's extra special to me when it's the MD or DO that also has the functional medicine training, right? Like you
Sure.
get to at least have the ability to go, ooh, wait, no, you're not ready for that. You need actually traditional medicine right now, or we
Yeah,
won't get all the functional stuff. Uh,
absolutely.
right.
Absolutely.
To be able to offer both is
Yep.
a sweet spot.
Yep.
But I wondered because I wondered if you were going to say no to that question because you're doing it all right. I'm the same way. I would go get functional medicine certified, but I'm a little too busy trying to grow direct primary care so that more patients and more providers and more staff get to experience medicine this way. Right. And
Yes.
then
I'm in the same
it's an
boat.
important part of what we do, but it's not where we're spending our time just now.
Yeah, and I'm all for, like, this movement, right?
Yep.
If
Yep.
people are getting healthier from this movement, great, and, I am all for it, and I wanna be part of it, and, as a physician, I wanna take on the people that are maybe a little bit more complicated or that
Yeah.
need a little combination of Western
Yeah.
medicine with functional physiology. Right?
Yeah.
So, and it's all about just having that long-term relationship because I do believe that, you should be invested in your health. I think it's kinda crazy that somebody can make $1,000,000 a year and not wanna spend a couple $1,000 on their health
Yeah.
when in reality, they have close to $100,000 coming in a month, and they're afraid of spending 1% on their health. I think that's a crazy concept. Because at the end of the day, if you don't have your health, you're kinda done. Like,
Yeah.
you're not gonna do your job as well, you're not gonna be as good of a Christian, as good of a husband, father, whatever it is, you're not gonna be living life to the fullest if you're not, grounded in those things. So,
I totally want to transition to purpose and
yeah,
how you see that affecting people's, how their spirituality and their purpose affects their physiology, not just their philosophy, right?
sure.
And it goes kind of to what you were just saying to some extent. And like I heard a you know, he came from the wealth management world, but it was a leadership thing. But he was like, "Hey, all these wealth management folks saying that there's the studies all prove that in order to retire well, you need three things. You need money, and everyone expected the other two things to also be money, but
Sure.
it was money, purpose, and health. Right?
Yeah.
You have money and health, but if you have no purpose, who cares? You can have money and purpose, but if you're not healthy enough to enjoy it, whatever. And if you have health and purpose, but you don't have any money, that's probably the best of the three, quite frankly. When
Yes.
you can always find a way, but it's hard to
Yes.
recover that way. Retirement's not really a biblical thing anyway. But so
No.
tell me how you handle this, how you bring purpose in. I know you said you're trying to bring community into purpose, and I would say that literally no one's purpose ever is themselves. Purpose by definition is outside of oneself, which
Sure.
brings in some sort of community. I think that's definitely so if you want to tie that into this pillar, but how do you
Yeah.
see affecting people's health?
Yeah. So you gotta establish, I mean, you gotta have that rapport. You gotta get that rapport later. You gotta get to know them before you kind of unleash that bomb of, "Hey, what's your purpose?" People aren't
Yeah.
just gonna, like, come out and say it. It usually honestly happens at the second or third meeting, and
Yeah.
once they've established, like, that they trust you, right? So I am careful about, like, what's your purpose? I will start with, like, who are you doing this for?
Yeah.
Are you doing it for yourself? Like, when in regards to getting healthy, are you getting
Yeah.
healthier, trying to get healthier for yourself, or are you trying to do it for somebody else? And whenever anybody says themselves, I'm like, okay, but that's probably not going to last, because, like, as a Christian, and as Jesus did when he was here on earth, is servant mentality,
Yeah.
right? I find so much more purpose when I'm serving my family, serving my wife, serving my kids. When I kind of back out of my own selfish desires, that's when I find that I'm at my best self. And then magically things just fall into place. It's kind of wild how that happens.
Well, you're way
But
less likely to let them down than you are to let yourself down about something you've told no one about,
Yeah.
right?
Yeah. Exactly.
That's
Exactly.
two different worlds.
Yes. Yes. So, I'm always trying to do things for other people. I'm not always good at it. Honestly, like being married, having kids, I found out how selfish of a person I am, like how much I actually think about myself. I have to catch myself a lot going like, dude, like be better to your wife or like,
Yeah.
get off your phone. Like that doesn't matter. Like your kid playing in the bath right now, like you don't need to be checking emails while you're doing bath time. Like
Yeah.
actually be present. So, and that's my world right now, and I love it. But how I translate that into my patients is really finding out, hey, like, yeah, you've got your job. Most people are that I work with are they're very high up in their careers, right? They've been very successful on paper, but you and I both know that you're not taking that with you when you go to heaven. So there's got to be more to it, and that's why I try to just always just pick away at until you find out. Like I have, one of my patients has a young daughter that has cerebral palsy, and everything he
Mm.
does is for that little girl, and her quality of life to everybody else is not good, right? She was unfortunately born with that terrible disease, but his purpose is making sure that she is loved, she is cared for, and she is just loved every single day. So when you find that out, then you can start tapping into, all right, we've established like what you feel like you're here on this earth for. And I encourage you to keep asking God what that purpose is, because the goalposts in life constantly change. Like I think the ultimate purpose for Christians is to follow God, follow Jesus. But as far as like that's the long term goal. What are like tangible goals
Yeah.
and
What does
purposes?
that
Like,
look like in the moment?
what does it look like? Like let's establish that right now. So once you find that, it's really um it's really amazing, because you find that these biomarkers and whatnot that you're following and measuring health off of really do get better. And that's where, like you
Right.
asked, like, where does physiology take place? Well, I think it first starts in cortisol, the
Yeah.
hormone of adrenaline, fight or flight,
Yeah.
that is wrecking every single person. And from social media, from thinking that, me being 35 years old, I follow guys that are 35 years old making millions of dollars, a year. I'm like, I'm never going to be like that. Right. That's like not good for your health. Right.
Yeah.
But so, so just trying to eliminate the noise, have a clear focus of where you're trying to go, and put blinders on the rest. And once that happens, you're sleeping better. You're finding out that when you're exercising, you can just actually meditate on the muscle fibers that are actually just pulling the weights up and down. And you can, if you ever had like one of those sessions of exercise, it's amazing, because you literally come out of it going like, whoa, what just happened?
Yeah.
It's actually amazing. That's why I try to meditate. The biceps, the easiest one. You could just like pick out like all your fibers contracting. When you have build these, you know, muscle neural connections, it's actually it's very amazing, because you're just going to, when you're blocking out the noise, you can focus on doing things with purpose. You're more intentional and you're present. And when in this world, when we're like so scatterbrained because we don't know
Yeah.
what our goals are or where we're going, you do a little bit of everything and you're not good at anything, or you fail subjectively because you're not doing like one thing really good. You're bad at everything else. So I don't know if I really answered your question, because it's tough to answer, but the
Yeah.
I
It's
do
a tough
find
question.
yeah, I do find that like when people find what they're searching for, and that's evolution too. They might not know initially, but once they find that out, they're sleeping better. They're wanting to exercise more because they understand that, hey,
Yeah.
if I do this,
Right.
I can be mentally more clear. And if they need to hear that, like, hey, did you know that if you are mentally thinking clearer, you could probably increase your salary by X amount, right? If you do that, you can maybe work 5 less hours a week that you get to spend that with your kids, right? So like you always got to find where people like find that like touch point, that carrot you dangle in front of people. They're like, that's what I'm finding. But
Well, and I think
inflame.
go ahead.
I was gonna lastly, just like from a physiology perspective, you see inflammation drop, you see hormones get better, you see sleep improve, you see IGF-1 recovery improve, you see organ health improve. There's a lot of things that go along with that.
And sometimes you can look at how purpose helps health by looking at the opposite, right? What does a lack of purpose look like in people's lives, right?
Yeah,
Like
yeah,
burnout,
sure,
inflammation, really bad habits. There's no consequence. There's really no. I'm not failing at my purpose if I just give up and stop trying. And so it's really you can't optimize a life that has no direction. What
right,
are you optimizing for? Right?
right,
You can have the best pickup truck for hauling things is optimized differently than a race car. What is your why? With
yes. What is your
with a
why?
why, and I love what I've loved about being an entrepreneur over the years, because I became an entrepreneur because I couldn't do anything else. I was either going to quit being a doctor or I was going to start something special and hope God blessed it. And if not, I was going to go build tree houses. That's actually a true story. But
Okay, okay,
um, another story, another day. But what I liked it when I started diving into how to do this well, I started getting into the goal oriented. Where's your why? Get some good who's around you. Like all of these, get the right people on the bus, going in the right direction, and
hmm
all of this business world wisdom that you can apply right here.
yeah,
It's
yeah,
it's true. The reason it works in business is because business is full of humans, and
yes,
humans work in a 90-day world, because if you try to give me a goal more than 90 days from now, I don't care and or I'll forget. And I need to
right,
be able to have closure on. So that's why I frequently have 90-day follow-ups on a lot of my patients. I just want to, they're
yeah,
like, well, I think I'm good. I'm like, yeah, you probably are. But if I check some labs on you in 90 days, you definitely won't fall off the horse, right? Like,
yeah,
so it depends on where
exactly.
they are and on there. Some people are so highly motivated that I would be in their way if I saw them every 90. But most people, it's fun to be like, hey, I'm just going to be some accountability and a way
Yeah,
to check in and encourage you and maybe help you take a next step. And it could
yep,
be a short visit. I know we have an hour
yeah,
planned. You don't have to spend it all. We always spend it
yeah,
all. But
exactly. And I do that
um,
with my patients too. I do 90-day, everybody gets 90-day labs regardless of what tier they're in. And then
nice.
some of my higher tiers, I'm like, hey, I'm checking in on you monthly.
Yeah.
So, and I always schedule it for a 15-minute, but I always like block out the next half hour of my schedule because sometimes the conversations get deep, or maybe you found that purpose on that call, like
Yep.
randomly, you weren't expecting it, but it just happened to come out. And once again, I'm very blessed to be able to have that. I know most doctors do not have that luxury of
Yeah.
time, but I have that, thankfully. But Pack, what you just said, my therapist, counselor, whatever you want to call her, I think it's a very healthy thing. You have like a doctor. You have when you're healthy. You don't get a doctor when you're sick. You get a doctor when you're healthy. You get a therapist when you're mentally healthy. You know,
Nope. Every
and
month I have an
she,
appointment. I'll think of
yeah,
something about. Don't worry
yeah.
about it.
And honestly, it's been she's like a faith based counselor that got referred to by another. I consider him like an older brother of mine. He's in the same space. We work together, and but something that she said, which applies to her case and as a counselor and us too as physicians, was she said, "I wish would hit the fan
Uh-huh.
sooner."
Yeah.
Because if people could see, like in her world, if you could see that your actions right now are going to lead to divorce in 10 years, would you change what you're doing right now? If
Right.
you could see that your actions or lack of actions, I should say, right now, you're going to get a heart attack in 10 years or you're going to get dementia. You're not going to roll the dice. Say it's 75% of people don't get it and you hit the lucky number. What if I could guarantee you that you were going to get it? Would you change right now? Because everybody is in this kind of, and we play this game all the time of like, I can't play God here. I can't tell you if you're going to get a heart attack. And it's crazy. Some of the people that we expect to get heart attacks don't
Yeah.
get heart attacks. There's people that we don't, expect
Yeah.
it, they drop dead. And it doesn't make sense. So we can't expect to play God. But man, if people could just see that their little tiny actions, because they don't see them right away. If I don't work out today, does it really affect me tomorrow? Not really. If I take a week off, does it really affect me? Maybe, maybe not.
Well,
And
man.
then that just becomes normal.
Yeah.
And then you start developing other bad habits, which, aren't going to kill you right away. It's just kind of wild. You wish you could just like hit somebody with a hard reality right off the bat to just like get them clear and be like, hey, you need
Yeah.
to figure stuff out right now.
There's a great Simpsons episode where Marge walks in on Homer eating a jar of mayonnaise and drinking a 12-pack of beer. And she's like, I won't try to do her voice, but she's like, Homer, you really think that's a good idea? And he's like, that's future Homer's problem. I sure am glad. And you're like, the writers are so good. 'Cause that's so human nature. Like, I'm so
It's
glad I don't have to worry about that. That's future Clint's problem.
yeah, not my
Okay.
problem right now. Yep.
Yeah.
Because we
No, I
can
use
deal
that.
with it. It's not the end all. Man, that's funny. I haven't heard of
Well,
a
dude,
Simpsons quote in a
Russ,
while.
gosh, what you're doing is awesome. What's
Thanks,
you're
Clint.
you're stationed in Arkansas, but you're telemed. So, I mean, what's your
Yeah.
reach? Who can reach out to you? How do we get a hold of you? Tell us about all that.
I got a big reach. I'm licensed in all 50 states.
Oh,
So I
wow.
can see anybody anywhere within not any time. I like to work regular
Yeah.
hours. But my company Black Sheep Health is personal, you know, doctor patient relationship. It's me and my other employee, and she handles just about everything, and I handle the people. So it's a small company, but we have access to just about anything and everything in the whole longevity space. So, but blacksheephealth.com, and yeah, would love to find out if anybody wants to be a client.
People will call. I know that you're young in this business and you're already got a lot of momentum and it's not by accident.
Yeah,
This is a need. People want personalized um, medical advice. They need a relationship with a provider to walk through
yeah,
this problem. And if you're not a Christian, it doesn't matter. You still have a purpose and you were created for a reason. So your faith is super valuable to all your clients from whatever walk of life they come from. So man,
absolutely.
it's really great to meet you, man. I knew when
Yeah, you as well.
I spied in on your website. I was like, "Oh, I'm gonna like this guy."
Yes, yes. It's been a pleasure, and I appreciate you having me on.
Yeah, man. Well, we should definitely circle back, check in from time to time.
Yeah,
I may
please.
do something like more topical with you because you've got a great sort of this whole longevity space and your foundation, your pillars, and all of that are all beautiful. So likely we just need to come back and talk more topically from time to time. But I'd love to have you back on. I appreciate you coming on the show.
Yes, thank you so much. Appreciate you.
Absolutely. Have a good one.
Thanks for joining me today on MyMD Unscripted. I hope today's conversation opened your mind and inspired you to imagine a better path for your health and therefore life. If you found value in this episode, be sure to subscribe, leave a review, and share it with someone passionate about transforming healthcare. Real change starts with real conversations, so let's keep them going. Until next time, stay well, stay curious, and never stop pushing for better.